I'm growing my mustache for Movember.
To grow awareness for prostate cancer, it's a good cause, and yeah.
It started last year. My grandpa got diagnosed with prostate cancer last year. He's symptom-free of everything now, so started last year and sort of doing it again, just sort of same reasons.
I'm growing my muzzy out for Movember because I'm raising awareness for prostate cancer.
Do you know what the prostate is?
What?
Do you know what the prostate is?
What do you mean the prostate is?
Not exactly. I have a general knowledge of it, but not exactly what it is or what it does, no.
It's testicle cancer.
Not really.
During the month of November, or Movember as most have come to know it, men grow out their mustaches for prostate cancer and men's mental health awareness. But as you just saw, a number of men don't even know what the prostate is. And I'll be honest with you, I was one of them. So I caught up with Dr. Vitug to find out more about the prostate and the importance of Movember.
The prostate gland is a small organ, basically the size of a walnut, and it sits just below the bladder, and it's used to produce fluid, which helps with fertility and male function. Aside from skin cancer, prostate cancer is the most common form of cancer amongst Canadian men, and actually the third most common reason for death amongst Canadians that have cancer.
To be more specific, according to the Canadian Cancer Society, an average of 65 Canadian men will be diagnosed each day with prostate cancer. If that's not scary enough, an average of 11 will die daily from the disease, making screening more vital than ever.
Screening is very important, but before one decides on being screened for prostate cancer, they should have a thorough and informed talk with their family physicians to weigh the pros and the cons associated with the testing.
The pros being early detection and better chance of survival, as well as less treatments and less recovery time. On the other hand, the test could provide a false positive or false negative, meaning you may have cancer and the test didn't detect it, or vice versa. Dr. Vitug says Movember is a good reminder for men to think about getting a checkup.
During the month of November, people are more aware of men's health. And so it's a good time, for men to think about their health, talk to their family doctors, and if they're in that category where they may be at risk for prostate cancer, they can have a full history, full physical, weigh the pros and cons of testing, and make a decision with their family doctor.
In one way or another, we are either directly affected by prostate cancer or know someone who is. So during the month of November, continue to grow your mustaches and raise awareness. With support and research, the average daily mortality rate may one day be lowered from 11 to 0. For Go, I'm Craig Momney.